Good evening, everyone. Let's start the session with our school song.
It all just feels like a dream to me, to find a school so true. And I know it's all in make-believe when I picture a school like you. The one thing that I learned from you is that I can make my dreams come true. Someday when I wake up to find memories of Billabong in my mind, imagine how that could be. Imagine how that could be. Teamwork, B for empowerment, and for mutual respect. B for passion, I for integrity, A for accountability. Billabong high, Billabong high, Billabong high, you know you can fly. Billabong high, you can touch the sky. Billabong high, Billabong high. We have aspiration over ambition. In our minds we have rhythm, courage and humanity. What makes us Billabong high is we believe we can touch the sky. Billabong high, Billabong high, Billabong high, you know you can fly. Billabong high, you can touch the sky. Billabong high, Billabong high, Billabong high, you know you can fly. Billabong high, touch the sky.
A very good evening to everyone. I, Saiba Singh from grade 7,
And I'm Mihika Singhania from grade 7.
welcome you all on a digital platform of Billabong Inspires Talk series.
On behalf of Billabong High International School, we would like to thank all the parents for their support and work towards our school.
Billabong Inspires Talk series initiative will bring together working parents from various fields of expertise. They will share their life experiences, which will help motivate and inspire the students towards achieving their goals. We won't
BHR,
have if we destroy the environment. Let us do our small bit to make the world a cleaner and happier, healthier place to live. Happy World Environment Day. Happy Environmental Health Day.
BHIS strongly believes in the core values, which inform your thoughts, decisions, and actions and help you align your career or life path to what's important to you. They're the essential foundation in finding your life's purpose because they remind us and others who we truly are.
BHIS core values are diligence, hardworking, persistent and resilient, service, generosity, enterprise or charity, leadership and stewardship, compassion, kind, empathetic and humble, resourcefulness, creative, risk taker, dynamic and outward looking, commitment to a large community, a family, a belief system, cultural models, sustainability and environment, integrity, honest, trustworthy, modest, and respectful.
Billabong Inspires Talk series is all geared up today for an interesting and enlightening session with our speaker, Dr. Richa Tandon, who will be taking us through a life's journey.
Dr. Richa Tandon, born and brought up in Kanpur, completed her MBBS in 2004 from King George's Medical College, Lucknow, and MD in Community Medicine in 2007 from GSVM Medical College, Kanpur. Currently, she is working as Chief Medical Officer in Central Health Services and practicing from last 15 years. Her hobbies are dancing, singing, and reading.
We would now like to welcome our guest speaker for the day, Dr. Richa Tandon.
Thank you, Mika. Thank you, Saiba, for such a warm welcome. A very good evening to all of you.
Thank you so much, ma'am.
Wow, ma'am, I've really got inspired from your journey, and we are both motivated to see your commitment towards your work.
Ma'am, we would like to ask you a few questions related to your journey and to your work. Also, students can ask the questions by writing in the chat box.
Ma'am, firstly, I would like to ask what inspired you to become a doctor?
My mom wanted me to be a doctor, and I didn't want to disappoint her. So today I am here, a doctor, in front of you.
Wow, ma'am. Ma'am, as a doctor, how much empathy do you have for your patients?
Empathy is a basic virtue of being human. And for us doctors, it is of utmost importance to enable successful treatment of patients.
Thank you, ma'am. What do we have to do for becoming a doctor?
So to be a doctor, or for that matter, for any career pursuing, you have to be first focused. You have to know exactly what you want to have in life. Then acquire knowledge about how to get it, and then work consistently to achieve it. Things are much easier for you children now because of the amount of exposure you have, because of the social media and the pool of information which is available. So medical training institutes have their coachings also, right from class 7 onwards, to enable the children who aspire to become doctors to get trained to take competitive examinations after class 12. So whoever aspires to be a doctor and is prepared to study for long years, maybe 8 to 10 or maybe even more, should start focusing on it right from class 7 or 8.
Thank you, ma'am. Ma'am, how do you stay up to date on current events in the medical and healthcare industries?
Yeah. So we have continued medical education programs from time to time on various upcoming health developments, which we keep attending to keep ourselves abreast.
Amazing. Ma'am, why did you choose Billabong for your children?
Good question. I was highly impressed with the curriculum of the school, the integrated approach using different modalities for teaching, and the emphasis on the physical activity of the children, which is why I chose Billabong for both my girls.
Thank you, ma'am. Ma'am, what is your philosophy with medicine and treating patients?
Okay, interesting. Saiba. So I believe in first winning over the trust of my patient. My behavior has to be conducive enough so that my patient starts believing in me. And then I follow an integrated approach involving medicine as well as lifestyle changes for successful treatment.
Wow, ma'am. Ma'am, what do you like most about practicing medicine and why?
The contentment this profession offers is invaluable. No amount of money will be able to buy me the pleasure which comes when a patient comes back to me and says, Doctor Sahab, aapke haath mein to jadoo hai. Main theek ho gaya. And this keeps me going.
Thank you, ma'am. Ma'am, if you were to describe yourself in 3 words, what would they be and why?
Saiba is posing difficult questions. Okay. So I see myself to be logical, focused, and sincere.
Thank you, ma'am. How frequently do we need to visit a doctor for regular checkup?
Okay. So as children, you should be very vigilant about any health related issue, whether physical or mental, which comes into your life, because addressing health problems at the advent is much easier than waiting for them to increase and then trying to treat them. So at the earliest symptom or sign of any health related issue, you should inform your parents so that they can take you to the respective doctor to address your problem. Be very vigilant.
Thank you, ma'am. Ma'am, do you have any enclosing thoughts regarding the session?
Yes, definitely. This is a very novel initiative taken by Billabong. And as a doctor, I have seen that in the past 10 to 15 years, there has been a shift in the epidemiology of health-related problems in our country, particularly in the middle and the upper socioeconomic classes. The disease pattern has shifted to lifestyle-related diseases more. And since you children are the building blocks of our nation, you should realize the importance of a healthy lifestyle right from now and start practicing it so that you have a disease-free, productive life ahead. So I would like to share a small slideshow which I've prepared for a better illustration on the importance of having a healthy lifestyle. Your health behavior should focus on the triad of nutrition, physical activity, and mental well-being. You should nourish yourself. As you can see in this slide, this is the Eat Well plate. Next slide, please. Your diet should have 33% fruits and vegetables, that is 5 servings of fruits and vegetables in a day. 33% starchy carbohydrates, 15% milk and dairy, that is 3 portions per day, 12% meat, fish, eggs, and beans, and less than 8% should be high fat or sugary foods. Next slide, please. The second focus point is your physical activity level. A 30-minute workout every day for more than 5 days a week is a must. It could be a brisk walk, it could be a jog, it could be a cycling activity or a heavy gardening activity. If it gets you slightly out of breath and you feel a bit sweaty, it's working. If it's a problem taking out 30 minutes at a stretch, you can take 2 15-minute bursts, which would be as effective. Next slide, please. The third, but not the least, focus point is our mental well-being. It has been realized lately that apart from physical well-being, mental well-being is of utmost importance. Mental well-being at your level, the best I could explain you is by you getting adequate sleep, that is 7 to 8 hours per day. You need to breathe. Now you would say that ma'am is saying breathe. We all breathe. How would we keep alive if we don't breathe, right? Breathe means watchful breathing, at least 8 to 10 times in a day. Deep breathing so that your brain relaxes. When you deep breathe, your brain relaxes. And you should carry an attitude of gratitude. You should be thankful for whatever you have in your life. This will maintain positivity in your aura and you will attract positivity. So mental well-being is of utmost importance at this age so that you can turn out into the healthier adults. So the take-home message from me today is eat well, sleep well, stay physically active, and be happy. Thank you so much.
Thank you so much, ma'am. Now we would like to read the questions from the chat box.
Sure.
So, ma'am, the first question here says, what challenges do you feel doctors are facing these days?
Doctors are facing the challenge of incomplete education and information from Google, which the patients acquire, and challenge the doctors with that.
The next question states that how do you ensure effective communication across medical departments?
Well, if you are working in an institutional setup, then definitely for effective communication across the departments, you have channels. You have internal channels which definitely communicate amongst themselves whenever an issue comes up. And if you are working in a private setup as an individual, that is your personal PR with the fellow doctors to communicate any health related issues which come up with patients, which require intermodality approach.
The next question is, why does going to doctors or even having a thought of going to doctors scare us?
It should not. Why does it scare you? I will ask this question back, whoever has asked me.
Ma'am, most probably because we think of doctors like they do surgeries most of the time. So we are very scared if there is something wrong.
Probably injections.
So every medical issue does not involve an intervention. Some medical issues can be solved only with counseling. Some require oral medications. Some require lifestyle changes. And a very few require interventional modalities. So next time you want to visit a doctor, don't be scared. It's not an injection. They are not sitting with injections ready in their hands to poke you.
The next question says that how do you manage home and work together?
Okay, so me at my personal level, I have a very balanced schedule. I have OPD hours from 8 to 2 and the rest of my hours in the day are for my house, which is how I'm able to balance both of them together.
So ma'am, as we got to know before that you love reading. So what is your favorite book and who is your favorite author?
To pinpoint a book would be difficult. I can pinpoint the genre I enjoy the most. I enjoy Indian mythology, fictional and non-fictional both. And I particularly enjoyed reading The Palace of Illusions.
The next question is, if you were not a doctor, what would you want to be?
A dancer.
Ma'am, the next question is, how is your experience as a doctor?
I mentioned it earlier, it is a very satisfying profession. I'm very happy being a doctor. I'm very happy when I'm able to relieve somebody of their pains and improve their, quality of life. But at the same time, I am pained to see the health status and the health related problems in our country. We being a developing country have a way to go in providing proper health care to all segments of the society. And I hope with consistent efforts from the government and from all of us at individual levels, we will be able to attain the goal of health for all.
Yeah, the next question asks that the things we eat these days are probably junk, so how can we avoid them?
So if you know that you are eating junk, and if you know that junk is harmful, then why are you eating it in the first place? Whenever you feel hungry, you give yourself options, which will have one healthy option and one junk. So a healthy option can be a fruit, or it can be a homemade snack instead of a packed snack. This is how you can avoid eating junk.
Sorry, ma'am, you can continue.
It's okay. Next question.
So, ma'am, the next question states, why do students don't want to take up medicine as a career nowadays? What would you have to say to motivate them?
Medicine definitely has long period of study involved, right? So this I said earlier also, whoever is prepared to study for long years should take up this profession. And believe you and me, it is a very gratifying profession. Once you are into it, there is no looking back. Because once you start relieving the people of their pains and it start improving the quality of their lives, you feel this is the best thing you can do on earth. The only thing you have to be mentally prepared is to put in long study hours, which is there in other professions as well. But yes, a bit longer duration of study as well. And then you can go ahead because it is the most gratifying profession, I feel.
Yeah, the next question is that if you're a trained dancer, then which form?
I am not a professionally trained dancer. I pursue dance as my hobby. I like both Indian classical Kathak and folk dance forms. Next question, please.
Ma'am, next question is stating that if someone, what are the further degrees in your field?
See, the field of medicine has undergone a sea change over a period of years. We start with a double graduation course known as MBBS, which is Bachelor's of Surgery and Bachelor's of Medicine. After that, we specialize in a particular branch, which we call the MD or the MS. That is Doctors of Medicine and Masters of Surgery. This could be any particular branch like eye or ear or heart, right? After your MD or MS, you have a super specialty in certain subjects, which we call as the DM or the MCH for the surgical branches. Even after that, you want to study more, there is more to offer. You can do various courses because now everything is, specializing to a greater extent. Earlier, if somebody is operating the ear, he is operating the whole ear. Now there is specialization into middle ear, inner ear, right? Similarly in the brain, similarly in the heart. So actually, it is endless. It depends upon your hunger for how much you want to specialize in. But they are doing wonders now in this field, the field of medicine, which we call it.
So with this, what is the one goal you would like to accomplish in the next year?
The goal I want to accomplish in the next coming year would be making the world pandemic free. I want to alleviate the anxiety associated with this pandemic. It has been an unprecedented past 2 years almost. Taught us a lot of lessons. And my goal and what I dream is that the next 1 year, after the next 1 year, we should be pandemic free. And that would be possible if we all follow COVID appropriate behavior till the fear of pandemic is present and it's not gone. And I urge you all children, whoever is listening today, to follow COVID appropriate behavior till the official announcement of the pandemic being over is not made.
Thank you, ma'am. Now it's time for some fun element. It's quiz time. Students will get 10 seconds for each question and they have to write their answers in the chat box. Disease of the heart, joints, and nervous system are called, and your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, degenerative diseases, given by Praful Chandran.
The next question is that what is a bacterial disease? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, tuberculosis.
Scurvy disease is caused by the deficiency of which vitamin? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option D, vitamin C, given by Vivan Gupta.
The next question is which of the following diseases is transmitted by an insect vector? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, malaria, given by Vivan Gupta.
Which of the following is true about the malaria disease? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, fever and anemia, given by Kashvi Tandon.
The next question is cholera is dash type of a disease. And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, option D, non-contagious.
The next question is, what does vitamin K deficiency lead to? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, given by Vivan Gupta.
The next question is when is World Health Day celebrated? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the right answer is option C, 7th April, given by Vedang Jha.
Which one of the following disease is communicable? And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, cholera, given by Kashvi Tandon.
The next question is the disease carrying agents are called. And your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
The right answer is option A, vector.
A droplet infection is, and your options are
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
the correct answer is option A, common cold, given by Rudraksh Yadav.
Many congratulations to all the winners. Please give clap reactions to all the participants.
Thank you so much, ma'am. We have got so inspired to see your passion towards your work, and I'm sure everyone must have been amazed to get to know more about your inspiring journey.
Our heartfelt gratitude to our founder and CEO, Mrs. Preeti Agarwal, for initiating such talks which kindles in us the curiosity to explore more. We convey our heartfelt gratitude to our guest speaker, Dr. RICHA Tandon, for the dynamic talk.
Your feedbacks and suggestions are the most important to us for raising the bar all the time. WhatsApp class group will remain open till 5:30 p.m. Parents and students are requested to share their feedbacks and suggestions in the class group.
Thank you so much, everyone, for being a part of this Billabong Inspires talk series.
We shall meet next week on 2nd October 2021 at the same time for BHIS Family Quiz. Thank you.
Thank you.